I'm Professor of Critical Care Medicine at University of Glasgow, and I'm also the Chairman of the Scottish Intercollegiate Guideline Network, which provides clinical guidelines for doctors throughout Scotland and throughout the world.
My background's in computer science. I did a PhD at the University of Aberdeen, and then I moved here to NHS Greater Glasgow and Clyde, where I'm now responsible for leading several research groups into innovative healthcare technologies.
So I am an anaesthetist and I specialise in neuroanaesthesia, which means that I look after patients having operations for usually brain surgery.
This is a project which is designed to collect information from the bedside, which is routinely displayed on the monitors next to the bed. A whole series of numbers which give detailed information about the physiological state of patients. This is very valuable information which is then used to manage care. This information is displayed but is then by and large lost. When the monitor is switched off, that information disappears. And there's such a volume of information that what we do is we intermittently record and save only a very small fraction of this data. Now we have very clear understanding that this data contains a lot of information which very accurately describes the patient's situation, but also can be used to predict future changes in physiology and improvements or deterioration in the patient and to guide care.
In healthcare, we're now generating huge volumes of clinical data. Whilst this is great, it's very difficult for clinicians to use that data, either to analyse it in research settings or to use it clinically at the patient's bedside. The Chartered Out project is aiming to develop the tools and technology to help clinicians use this data.
It's a really interesting project because it's a collaboration between the NHS, so my clinical specialty in neurocritical care, between Glasgow University and between Iridia, who are an informatics firm, and Philips Healthcare, who are a provider of ITU monitoring systems.
So basically this project is to say, can we collect this data? Can we then take this data and analyse it in real time, and then with the analysed data, then display useful information at the bedside to guide clinical care?
The project will be demonstrated in the neurointensive care units here at the Queen Elizabeth University Hospital, and we will be looking at developing various components, the first of which is the ability to automatically extract high volume data from the clinical monitoring equipment, automatically anonymise that data, use a platform, a high performance computing platform, which is able to analyse the data, and then we'll be able to present the results from any analyses live back at the bedside.
The project is looking at linking the clinical environment to the analytics expertise and analytics environment that Iridia provide. And the idea is that there's lots of interesting ways that we could be analysing the data that we collect from our patients in the intensive care unit, but we don't have the time and we don't necessarily have the expertise and the technology to do that. So that's been provided by the Iridia platform. And the sort of things that we're looking at are, when people are admitted to the neurointensive care unit, we need to make sure that their brain gets an adequate supply of blood, and there's types of analysis that can give us an indication of whether or not that's happening. And so what we're doing is diverting all the data that we collect in the neurointensive care unit through the Philips system to the Iridia platform to do analyses on the platform. And then the really interesting and exciting bit of it is that we're then redirecting that data back into the clinical environment so that it could be used to help us manage our patients.
Now, to start with, this is clearly a research project, but the beauty of this system that we're describing here is that the data is taken from the bedside, taken to a remote site and analysed. This means that the remote computer system analysing it can analyse data from anywhere, from different patients, or even from different intensive cares, or even from different countries. And you only have to have a program which analyse this data in one single place. What has bedeviled this type of research in the past was the need to have a computer at every single patient who you were actually trying to collect this data on. This was very time consuming, it was very slow, and it meant that projects looking at clinical data actually just collected a very small amount of data from a very small number of patients and produced results many weeks, months down the line. So this is to make this whole process much quicker and able to spread it widely.
It means that we deliver technology which is clinically relevant.